Everyone, thank you for attending today. I'm really excited to talk to you about the mother and baby unit that we're going to be opening at Cheshire and Royal Partnership later this year. So we've just got a bit of a whistle-stop tour of all things perinatal and MBU, and we'll have an opportunity for questions at the end. So we'll just go through and you'll hear from each of us as we go throughout the session. So all your mics and cameras are automatically turned off. If anyone does have a question at the end, we can unmute you if you don't want to put it in the question and answer box. But please use that throughout if you have any questions, and we'll come to them at the end. So we're going to go through some introductions, just a little bit about CWP as a trust, about the perinatal mental health service, where we're situated, where we cover what we do, and then some really detailed information on the mother and baby unit that's coming to the site. So I'll start. I'm Amanda Bale. I'm the recruitment manager, and I'll be supporting with the recruitment and onboarding for this project. Sarah?
Hi everyone, I'm Sarah Hall. I'm the operational lead for perinatal services in the trust.
Thank you. Elaine?
Hi, I'm Elaine Worrell. I'm the ward manager for the mother and baby unit.
Thanks. Bev?
Good afternoon, everybody. I'm Debbie Griffin, and I'm the service manager for the Betsy Cadwallader perinatal mental health team.
Thanks, Debbie. Bev?
Hi everyone, my name is Bev Sapre. I'm a consultant psychiatrist and I'm clinical director for perinatal services in CWP.
Thank you. Okay, so this is just a little bit of information about Cheshire and Royal Partnership NHS Foundation Trust. So we were founded in 2002 and we achieved our foundation status in 2007. And we have over 3,000 employees across our 3 localities, which is Wirral, Cheshire and East Cheshire. But we also do cover some other areas, as you can see here. We also have some teams based in Trafford, Warrington, Bolton, Halton and Liverpool. We predominantly work with mental health, learning disability, all age disability care and physical health patients and service users, and we have over 1 million people using our services and 2 million using our highly specialist services across those localities. We use a values-based recruitment model, and this links back to our 6 C's, as you can see on the screen here. So these are the values that we have as a trust, and as I said, we do have a values-based recruitment model, so you'll see this sort of throughout your journey as an applicant and potentially a future employee. We base our appraisals on this as well. So these are our 6 C's, as you can see, and this gives a bit of a vision of where we are and how widespread our locality is. So we have loads of different teams, as you can see. I'll leave this on the screen for a second so you can just see where all of our different teams are based. And Bev, I'll hand over to you for the perinatal service.
Hi, good afternoon everybody. I'm going to give you a little bit of a overview of the perinatal services as they are at the moment, because while the mother and baby unit will be a standalone separate service, we will be inextricably linked with the community service, and patients will be moving between both the community and the inpatients, and we will be working very closely across community services and the inpatient. So to start with, I'll just give you a little bit of background history to where perinatal services in the region started. So we come under the banner of Cheshire Mersey Specialist Perinatal Services, and that is a partnership arrangement between Merseycare and CWP, so something quite unique. We have 3 teams that make up the service, and they're marked with an X. So we have the Liverpool and Sefton team that comes under Merseycare. We have the Mid Mersey team that are based at Hollands Park in Warrington. And then CWP, because of our geographical spread, we've got 2 bases. We've got one in Ellesmere Port at Pioneer House and one over in the beaches over in Macclesfield. So essentially 3 teams make up the whole of the service. So while we work and operate as 3 separate teams across the 2 trusts, we work to the same service specification and the same standards, and we work really closely with each other to make sure that the standards and there is consistency across. So if we cast our minds back to 2016, and just maybe the year or so before that, the government announced a huge investment in perinatal services. And this was born out of a few high-profile, very influential pieces of work and research from the London School of Economic, also the Embrace report, which looks at maternal morbidity and mortality. And really everything was pointing towards the need for specialist perinatal care for women and their families. It was identified that there was a lack of specialist provision when there was actually a requirement for it, and that, you know, acknowledging that the second highest cause of death in the first 12 months after a woman gives birth is the highest risk really is there for suicide, being the second highest, after cardiac. So given the absence of the provision of services, an injection of cash happened nationally directly from NHS England. Now, I speak mainly for England. Scotland and Wales have also expanded, but slightly differently according to their own investment from their local NHS regions. However, in England, CWP and Merseycare came together, we came as Cheshire and Mersey Perinatal Services, and what it meant is we had quite a lot of strength in terms of our commissioning arrangements, because we went to the commissioning as one service. And so what that's meant is, with each wave of funding, so while funding was initially released to us in 2016, year on year, they didn't give us all the money in one go. Year on year, we had to then locally negotiate with our commissioners to get the next waves of funding. Now, we were really, really effective in our region, and we've had really good relationships with our commissioners, and we've had the full scope of funding that was available under the NHS long-term plan. So where are we now? Well, back then we were a team. Each of the three teams were very small: a couple of nurses, a doctor, admin staff, and psychologists. So no more than about 10 to 12 people per team. Now each of the three teams have in the region of, give and take, 65 to 75 plus staff, not necessarily all whole-time equivalents. So that's been a massive expansion in what we do. We've gone from being a service that was very much doing a lot of care coordination, medication management, to having a number of pathways that we offer. So not only do we work with women during their pregnancy, we work with women up until their child is 2 years of age. And within that, we will do all the core business of what will happen in a secondary care mental health service. So looking after mothers with their moderate to severe mental health difficulties. But we also have other pathways that complement that, which make us unique as a perinatal service. So we have a parent-infant pathway, we have care partners pathway, thinking about the whole family's needs. And with the growth, we started off, as I said, very basic. I've had to write them all down because I always forget when I say what's in our service now. So we have, quite frankly, a Rolls-Royce level of provision, and what women and their families get in our region is second to none. So we, as well as the doctors and the mental health practitioners and admin staff and psychologists, that has expanded to therapies in a number of domains. So we provide CBT, family therapy, compassion-focused therapy, and you know, there's so much more that we do, and our therapies team really is very, very broad. But with that, we have specialist health visitors who can lead on the parent-infant pathway. We have parent-infant practitioners. We have a specialist social worker. We have peer support workers. So we are very, very broad in what we offer, and really any need that we can identify, we're able to work closely with. With the growth of our service, we've also built really good relationships with our stakeholders. So this is kind of a good place to start, really, is to say, you know, we've started off small, went big, but we've worked really closely with maternity systems. So we have good working relationships with midwifery, and that means, you know, we have specialist mental health midwives. We provide supervision and work very closely with them. We work well with Family Nurse Partnership and with health visiting in our region, and provide a lot of training and supervision to them, and pool our kind of assets within our networks. And then, as well as that, we also do a lot of work with our secondary care colleagues within mental health as well. So we have expanded massively, and with that has meant a lot of change and a lot of recruitment. So the team here today, a lot of us involved in the recruitment for the mother and baby unit, we were quite well versed at doing recruitment now, because we've had to do so much of it. The service, along with its growth, has really come leaps and bounds in terms of so many other areas. We are now PQN accredited, so that's Royal College accredited as being of the best quality and best standard of practice that's available at this current time. That accreditation will last for 3 years. We've also got a big research base. We have publications that have come out over the last couple of years. We had at least 5 publications last year, and we're doing a lot of research and have been the pilot sites for quite a few research projects as well. So we're really pleased with the growth that we've received, and we're going to take a lot of that learning around recruitment and what people need when they come new to service, because bearing in mind perinatal specialty is very new, and we've had to upskill people to become confident as practitioners in this area. So rest assured, all of that learning will be taken forward for anyone who comes and works in the mother and baby unit as well. So yes, we carry on growing, and our next big venture, which we're excited about, is the mother and baby unit. So I'll pass over to Sarah.
Thanks, Bev, and hi everyone. So obviously what everyone's here to hear about today is the new mother and baby unit coming to the Countess of Chester Health Park site at the end of this year. We've named the unit now, so it's called Seren Lodge, and a name was chosen by a group of experts by experience who have been amazing and lending their time to us. They've been women who have been admitted to mother and baby units previously. So Seren Lodge was chosen by them, with Seren meaning star in Welsh, with a nod to the North Wales part of this project. So Seren Lodge will be a mother and baby, a specialist inpatient unit that provides care, support and treatment for women with really severe mental health difficulties we can admit from 32 weeks of pregnancy up until baby's 1 year old. The women on the unit are our patients, and their babies are deemed as guests. And the aim of mother and baby units, there's 19 across England and Wales and Scotland now, but the aim of mother and baby units is to really replicate as much as possible a home from home environment. So women who are not able to stay at home because of their mental ill health in the perinatal period, but we know that if women are admitted to hospital during this time and separated from their baby, it can have a really adverse impact on both mum and baby in terms of bonding and development. So we know that ideally we need to keep babies with their mums to really allow that relationship to develop and grow, and that's what mother and baby units are there for. So mother and baby units encourage the women on the unit, when they're well enough, to provide the care for their babies. They are looking after their babies. Obviously there'll be support from staff, different levels of support depending on the presentation of the women at that time, but we very much encourage women to nurture their relationship, and so try and make the transition back home as seamless as possible. We also, for mother and baby units, very keen on keeping support networks involved. So for women who have got other children, older children, partners, grandparents, etc., we very much encourage that support network to be present on the unit to support the women and the babies on the unit. And normal parenting activities are very much encouraged. And we're really lucky that we've got 2 outdoor spaces in the design of our unit, just to really help that growth and nurture. Next slide, please. So the reasons why mother and baby units are so important. What we know from research is 1 in 5 women will experience mental health difficulties during their pregnancy and first 12 months of their baby's life. 5 in 100 women will experience severe mental health problems, and luckily rarer, 4 in 1,000 women require mental health related admission during this time. But that is still a significant number of people when we look at our population. We know that severe mental illness in this period can really undermine a woman's confidence in her ability to be a parent and really adversely affect that mum and baby relationship, which is why it's so imperative to keep mums and babies together where we can during this time. And it's widely recognised that a mother and baby unit should always be the preferred option if a woman needs admitting during the perinatal period, to really nurture that relationship. Now, where we are at the moment, we are lucky. We have a mother and baby unit in Wythenshawe in Manchester and 1 in Chorley. There are 2 local units, and then for Wales there's 1 in Swansea, which certainly isn't local. It's a good 5-hour drive. But what we know from the research and the data and linking in with our other local units, we know that the the demand still outweighs the capacity for mother and baby units, and that women in our areas are having to travel sometimes hundreds of miles to receive this care, which takes them away from their support network. So quite often, you know, there may be financial issues where partner, grandparents, etc., just cannot facilitate that visit to the mother and baby units that women are in, and it's really important to keep people as close to their geographical network as possible. Next slide, please. So we, as I say, we know that demand is outweighing capacity for the other mother and baby units, and what we know for North Wales is that the only other Welsh unit is in Swansea, and that's the only option of women being able to access care that might be in their preferred language of Welsh. So it's a really difficult geographical move for people across the country at the moment to go to mother and baby units where bed space is very limited. So for North Wales, there was I mean, Debbie can inform me further when she talks, but there was a lot of research around is a mother and baby unit just for North Wales sustainable, and it was clear that it wasn't, that the demand would be for 2 beds. So NHS England and NHS Wales have collaborated together with this project, and Seren Lodge will be 8 beds, with 6 beds being for the women and children, the women and their babies of Cheshire and Merseyside, and 2 beds being specifically for women and children from North Wales. And obviously, if we will also take national referrals if we have empty beds and the need requires. Next slide, please. So just a bit about the location. For those of you who are familiar with CWP services, we have Bowman Mental Health Unit, which is the adult acute wards, on the site of the County Chester Hospital, with Ancora House, our CAMS inpatient unit next door, and Churton House is opposite those 2 buildings, and that has been refurbished to make Seren Lodge unit. So it's on the site there. Obviously, it's close to rail links, it's close to good road links. It's also very close to our border with North Wales, so to really hopefully try and make that transition for women who need admitting from North Wales much easier and in a much more supportive way. We will have GP, midwifery, health visiting and social work provision within the MBU, sort of linking in, and there'll be close links between mother and baby unit and our perinatal services, and also our adult acute wards will also have close links with us for any support that's required. Next slide, please. This is an artist's impression of what the external of what's now Churton House and will be Seren Lodge hopefully will look like after all of the work's finished. Next, please. We've also got, I know it's very difficult to see, but it's a basic plan of the interior. What we've been really lucky with is having such an amazing group of experts by experience. So women who've experienced being admitted as inpatients to mother and baby units before, who gave us and the architects really, really good advice on best layout, what's needed in the unit, and just able to really give us lots of time and support around. So we feel that we've been able to design a unit that really, really meets the needs of the women and birthing people who will be admitted. Each bedroom has got an ensuite. One of the bedrooms will be adapted so for accessibility, or for any twins that need to be brought onto the unit with their mother. And there's 2 gardens on either side of the unit that are accessible. Next, please. So I'm going to hand over to Debbie now, who will give a bit of the Welsh context.
Good afternoon, everybody. So this next slide is just going to take us through kind of the access to make sure that access for our Welsh women and birthing people is equitable. So every effort will be made to facilitate women giving birth back in Wales if that's their wish. And we have really given consideration with that. We've collaborated with midwives across Wales and England and our safeguarding leads. And whenever possible, our women will be supported to travel back into Wales to have their babies if that's their preference. The use of Welsh language has been considered at all times and throughout our development process so far, and that covers the care provision, the welcome pack that we'll give to every family, and bilingual signage, not just within the building itself, but also in the immediate vicinity on the Countess of Chester site. Accommodation for families and partners to stay on the unit has been embedded into the plan, and that, as Sarah's already referenced, is really important for our families. At the moment, our women are having to travel sometimes 4 to 6 hours to access a mother and baby unit bed, and if there's a young family and siblings, you know, maybe there's some financial constraints, it's often really difficult for visits to happen, and that's a really important part of recovery. So we've done everything we can to make that a little bit easier. In terms of robust links, we have a really good, so our BCU perinatal service has really robust links with the CWP perinatal service, and we've developed even kind of closer collaborative links regarding the development of the mother and baby unit. We also have a group of Welsh experts by experience who have been involved throughout the development process so far. And as an additional kind of bonus to that, really, we have now embedded that we have a monthly meeting with our Welsh experts by experience across Wales, just to inform our practice generally and to develop and improve services. So really positive thing that's come out of the MBU development. Next slide, please, Amanda. So in terms of our experts by experience, we consider them to be equal partners and families and carers, and that they're at the heart of our new mother and baby unit. So we're working in partnership with local families with lived experience of perinatal mental health difficulties and our clinical teams who are the experts in what outstanding care should look like. And there's a quote here from Heidi, who is one of our experts by experience, and she's also a peer support worker in the CWP perinatal team. So she says, after previously being admitted to a mother and baby unit myself, I am loving being involved in the development of the new unit and helping to shape the plans by drawing on my own experience. Ultimately, it's all about helping other women and their families recover and receive care closer to their home and support networks. And you'll see there in the top left-hand corner, there's a couple of photos from kind of when we've had workshops and engagement sessions with our experts by experience, the architects, the builders, everybody who's involved, just to make sure that we get this as right as we possibly can. Next slide, please. So our Experts by Experience programme, Experts by Experience will be on all key LPC groups as equal partners in the development of clinical models of care delivery and to be part of all decision making. Our programme will work with specialist perinatal mental health service engagement and co-production leads regarding building on the existing resource and relationships that we have, for example, maternity voice partnerships, clinical networks. There'll be a dedicated programme of recruitment and training for experts by experience to ensure they are supported to play a full and active part in the LPC. The engagement events will be held, a dedicated webpage on the LPC website will be developed, and community ambassadors and champions will be trained. With regard to women and families with neurodiversity, we've engaged with them to advise on the design of the building, particularly to do with the lighting, the acoustics, the wall decor, you know, to make sure that our wallpaper or however we decorate the walls is not too overstimulating. And then the needs of the mothers and families from North Wales will be specifically addressed through bilingual support services where needed, and that will be 24 hours a day. So next slide, please. So just a list of things that our experts by experience asked for specifically, because sometimes we have ideas about what would be good and what is needed, and it's not always what the experts by experience really value or would like. So the list they gave us was a sensory room, hairdressing and beauty station, parent-infant groups, a therapy garden, a recovery tree, a safe, soft play area, a homely feel throughout the unit, and baking and craft activities. Next slide, please. Back to you, Sarah.
Thanks, Debbie. So this is just a list here of the staffing model that will be staffing on the unit. So there's operational lead, which is myself, and I bridge over the mother and baby unit and the perinatal community team. Ward manager, which is being recruited, and Elaine is on this meeting. Consultant psychiatrist, speciality doctor, band 6 clinical leads, band 5 mental health nurses, a clinical psychologist, an OT and an OT assistant, nursery nurses, clinical support workers, peer support workers, a ward clerk, a specialist social worker, and the outreach team, which will support women during home leave and in their immediate period after discharge. So that real robust link between us and the community service. So that's the end of the presentation, but we'd like to open up the floor to any questions or comments. I think, Nick, you're going to keep an eye on the chat box, aren't you, or the question and answer box?
Yes, so if anyone's got any questions, please pop them in the Q&A box. We're happy to take any questions. Our last session earlier in the week, we had lots of questions, so please don't be shy, pop your questions in. Alternatively, you can pop a hand up and I will take you off mute. Just there is sometimes a little bit of a delay, so we'll give it a few minutes if anyone's got any burning questions. I think it's probably fair to say, isn't it, Sarah, we had quite a lot of questions about the types of roles, so it might be worth just kind of perhaps popping back to that slide. So we've got our first question now. So just interested, would you be recruiting any midwives for the mother and baby unit?
So not directly, there won't be a direct recruitment for midwives, but what we will have is midwifery support. So what we're probably looking at is a link with one of our close birthing hospitals, and they for the mother and baby units, the midwife from that unit who is nominated provides that the midwifery care on the unit.
Lovely, thank you. I've got a question here. I'm just going to attempt to try and allow mic and allow camera, and then the person should be able to take themselves off mute and ask the question. I think it's Becky.
Hi, I'm really sorry, I can't get the chat box to work. It won't let me click on it.
Don't worry, no problem. If you've got a question, feel free to go ahead.
It was just about, obviously, infant feeding, if there'd be any infant feeding provision or any roles relating to that within the unit to support mums and babies.
So there's we're really lucky in our perinatal community team. We've got 3 specialist health visitors, and what we are hoping is that part of their role will be to support the nursery nurses on the mother and baby unit. So we have to have health visitor provision on the unit of half a day a week, and the nursery nurses will have support from the health visitors around infant feeding, so that support can be given to the women and babies on the unit.
Thank you.
Thanks.
Thank you. So I'll bring Michelle in. I'll just take you off mute and then allow your microphone if I can. There you go. Should be able to take yourself off mute now. Oh, I think we've lost Michelle, so hopefully she'll come back. Amy, I'm going to try and come to you next.
Hi, can you hear me?
Yes, I can hear you, thanks.
Oh, beautiful. It was just a follow-up question to, I think it was Becky's question about infant feeding and supporting mums with their babies with kind of baby care. With the nursery nurses, would they be rostered on, would there be a nursery nurse on each shift?
Yes.
Yeah, okay.
Yeah.
So would the mental health nurses have any role at all when it came to the babies as well?
Yes, absolutely. So for all staff on the unit, the support of bonding and attachment between mum and baby is absolutely imperative, and all staff will be upskilled in respect of sort of bonding and attachment and that care between mum and baby. The nursery nurses that role is very specific in providing support around baby's growth and development, and there will be a nursery nurse on every shift, so that's day and night. It's 24/7 cover for the nursery nurses, but they will also have support from the nurses as well.
Would there be, if there were any concerns about the baby's health, would there be any medical support? Because I think they, like you said, they're not admitted. The mum's admitted.
Exactly. Yeah, you're right. So babies are guests, and if there was a concern about baby's health, we will have a GP link. But if they couldn't remain on the unit, obviously we'd link in with children's ward, neonatal ward, for example. When women are admitted, their baby has to be well to come with them. But obviously things could change during the time of admission, and we might need to get some more support for baby. But we would go out rather than have any further medical support on the unit, if that makes sense.
And sorry, this is my last question.
Okay.
Would you take premature babies?
Yeah, as long as if they could be discharged home from hospital and all of their medical needs are met, then yes, we would.
Okay. All right, beautiful. Thank you.
Thank you.
Lovely, thank you. So we've got a few more hands up now. So Kirsty, I'm going to try and come to you next if I can. Kirsty, you should be able to take yourself off.
Hi, yeah, I've sorted it out. I'm just interested to find out what sort of qualifications are needed and basically what's entailed in the roles of the nursery nurse, clinical support worker and peer support workers.
Yeah, of course. So nursery nurses, the essential criteria is NNEB or MVQ level 3 in childcare or its equivalent. So they're band 4. The clinical support worker, which is band 3, there's less sort of qualifications required. We have to have completed the care certificate, which you can do or be willing to complete it upon appointment through CWP as a trust.
I already work for Countess. I'm a healthcare assistant.
So if you've got the care certificate,
and I've already done that, yeah.
Yeah. So and the peer support workers are one of the main criteria for the peer support workers is that they have a lived experience of being admitted to a mother and baby unit as a patient and or being under perinatal mental health team.
Right, okay, that's great. What sort of hours would each of the roles actually entail?
So the 24/7 cover is from the band 6 clinical leads, the band 5 nurses, band 4 nursery nurses and band 3 clinical support workers, and they're the equivalent of the 8 to 8 shift or similar with the 7:30 time for handover, but it's basically the 12-hour blocks.
Right,
and the rest of the staffing is Monday to Friday 9 to 5.
Right, okay. And then also I'm just interested, do you actually take on part-time as well, or is it just full-time? Part-time.
Yeah, it's a mixture. Yeah.
When are the job opportunities going to become available to apply?
So we're hoping to go live to advert by the end of this month.
Okay.
And it'll all come out together.
Perfect. That's great. Thank you very much.
Thank you.
Might just be worth noting there, Sarah, that there will be quite a long lead-in time just to allow for shortlisting. So although they'll be opening, probably it will be like a phase process, won't it?
Yeah, thanks, Nick. So yeah, there will be a long lead-in. So we have funding for all staff to be in post 3 months prior to opening, and that's to provide a really robust induction, shadowing opportunities, training, etc. We anticipate the job adverts to be out for longer than usual, just to give everyone as much opportunity to apply. The shortlist, we expect high demand and high interest, so the shortlisting will take us a long time, and we're hoping that interviews will take place around April.
Right, okay. And then when is it you're expected to open? You said the end of the year, but roughly what month, end of year?
So roughly autumn. Autumn, yeah.
Okay, perfect. Thank you very much.
Thank you.
Debbie, did you want to come in there?
Yeah, I was just going to say, in addition to the CWP post and the MBU post, that there will be some opportunities for recruitment in our BCU team as well. We are expanding our service because, particularly with regard to the outreach team, the offer for outreach for the mother and baby unit is purely within CWP and for the MBU. So we had to make sure that that was equitable across women who might access the unit across North Wales. So we have been given approval to recruit to a full-time Band 6 assertive outreach post that will sit within our service, and it will be half-time for assertive in-reach outreach to the MBU and half-time as an enhanced triage role within our community perinatal service in North Wales. So watch this space. That will be again recruited to within the next, hopefully the next 3 to 4 months. So there are kind of, keep an eye across both areas for jobs. It's not just going to be CWP and the MBU that will be recruiting in relation to the mother and baby unit. Thank you.
Lovely. I'm going to bring Megan in next. Megan, you should be able to unmute yourself now.
Hi, yeah, I was just wondering, are you going to be employing newly qualified Band 5s?
There will be opportunities. So obviously, excuse me, we'll need a skill mix. But what we do know is that experience in perinatal mental health is rare. So we provide training for all of the staff in terms of perinatal aspects. We will need a cohort of experienced staff who have worked on wards before and know the ropes, but we will also welcome applicants from newly qualified.
Just because my role is a dual award, so I'll be children's and mental health trained. So
Yeah.
if you need somebody like who had children's experience also on the ward.
Brilliant, thank you.
Thank you. So we'll come to Lauren next. You should be able to unmute yourself. Are you there, Lauren? If not, we've got a few questions coming in, I think, in our chat, so we'll just come to them, one of them while Lauren tests the microphone. So question, would we recruit and take Band 5 and hold job until qualification in the summer?
Yeah, potentially.
So worth applying.
Yeah.
So there was just clarification about where the unit is based. So the unit is based on Countess of Chester Health Park. Postcode's on our website. If you Google Seren Lodge, the postcode will come up and have a quick look at it. So another question from the chat. So would OT hours be flexible for assessments, for example, being present in the morning and evening to support these routines?
That can all be discussed, and we certainly will be as flexible as possible for patient need.
Hopefully that's helpful to know. Do we know yet what psychological therapies will be offered?
So it hasn't been set in stone. Obviously, we've got a lot of experience in our perinatal community teams of offering psychological therapies to women in the perinatal period, and that includes CBT, CAT, COSI, which is Circle of Security training, which really looks at bonding and attachment, EMDR. So we know the evidence base. Obviously, we need to see what the successful applicant has qualified in terms of the psychologist as to what we can apply.
Thanks, Sarah.
Yeah, I think to add to that is we'd be looking at the skill sets of the applicants, but also we're taking a lot of learning from Chorley and from Wythenshawe. And because even though we're 3 separate units, we consider ourselves like a northwest asset. So we would, when we're up and running, we'll be linking quite closely with both other units to make sure that we kind of are offering very, kind of consistent care, that we're not varying ourselves too much. So whatever's offered on those 2 fronts as part of our processes for, getting ready to launch, we will be very much mirroring what's on offer in the other 2 units.
Thank you. So perhaps a question for Debbie and Sarah, this one. So what qualifications do you need to be part of the outreach team or outreach post?
So they are mental health practitioners. I think I'm right saying, Debbie, that your job description is the person's spec is the same, isn't it, or very similar. So mental health practitioners, and who they will need to hold a core qualification of either nurse, midwife, occupational therapist, or social worker. I think that's the same for you, isn't it, Debbie?
Yeah, exactly the same.
Thank you. I'm just wondering, Lauren, are you there, and can you get yourself off mute to ask your question? I think we might have lost Lauren, unfortunately. So we'll come to, I think, Michelle, you're next on the list. So you should be able to unmute
Hello.
yourself now.
Thank you. Yeah, thank you. I've got a couple of questions. So one was about the outreach. Did I catch that you said it's 9 to 5, the outreach role, Monday to Friday?
Yes.
And following kind of discharge, is there a time that you would support, or is it until their care plan finishes when they feel well enough to move forward without your team?
Yeah, so we're just sort of in the middle of with the drafts off for the outreach
Yeah,
team.
okay.
But basically, it's what we'll look at is when a woman's discharged from the mother and baby unit, they will automatically go to the perinatal community team of their area. The outreach team is like a bit of a bridge to give more intensive support.
Okay.
So with home leave visits, etc., but also upon when they're discharged, if they require more intensive support than what the community team can give in that time, the outreach team will be able to support with that.
Okay, so if successful, would the outreach team be more part of the perinatal team and sat kind of like in their base, or do you know, or more in the
very
ward?
Flexible.
Right. Okay.
And not the problem, but the issue, I suppose, with outreach teams across the country is they're all so different in each area. So there's not really a model that we can work off.
Okay.
But they are very much part of the mother and baby unit. The staffing model will be sat, if you like, within the MBU building. However, it'll be very flexible, because obviously they'll be travelling across the patch, and they can absolutely come in. We'd expect there'll be a lot of joint work with our perinatal community team.
Okay, thank you. And then is there a recruitment pathway for bank, because it's such a specialist unit? I've obviously do bank at Beaumere and Ancora, but would you have a separate bank team, because you might need the extra training and with babies, etc., in the perinatal period? There will. And will they go out at the same time as your recruitment drive? Will we have to apply for that?
So I think, Amanda, you might be able to just remind me of this. I think what we've agreed for bank is anyone who's on the CWP bank already can do the additional training to be able to bank on the mother and baby unit. And then there'll also be options for new people to come on. I don't think they'll be out at the same time as the permanent advert, so it might be a bit later.
Yeah, okay, that's fab. I'm on the bank anyway at Beaumere, so I'll just, okay, thank you very much.
Thanks, Michelle.
Sarah, is it okay if I just come in about the North Wales outreach, because it's a slightly different model?
Yeah, sorry.
So just for information really, so our post will sit very much within our community perinatal service, but will be very much linked in with the mother and baby unit team as well. So, but it will fall under the auspices of the BCU perinatal team. And because of some of the challenges that we have across North Wales with community mental health teams and their ability to respond and provide the level of support that some of our women need in the initial weeks after discharge, it's been agreed and will be in the job description that our enhanced triage assertive in-reach outreach post will provide interim care coordination for 28 days after discharge to any woman who is discharged from Seren Lodge. So there's a bit of an additional bit to our post.
Thanks, Deb.
Thank you. So we're coming to Nat next. You should be able to take yourself off mute.
Hello, hi. I just wanted to ask about qualifications for the clinical lead posts.
Yeah. So
are they specific? Oh, well, sorry, I'll let you explain that first.
No, you're asking if it's specifically mental health nurses?
Yes, that's the first part. Yeah.
Yes, it is. Yes.
So I've qualifications as a general nurse and as a health visitor. So would they not reach the requirements? No.
not for the inpatient units. So the nurses on the inpatient mother and baby units, it's very much mental health nurse.
Okay.
For mental health practitioners in the outreach team and mental health practitioners in both of our, same in North Wales as well as CWP, then any type of nursing is fine.
And so when you mentioned earlier about the health visiting role, is that just an external health visitor coming in to support in the unit?
Yeah, so it's something that we are in the middle of finalising, but we in CWP we have 3 specialist health visitors that work in the perinatal community team, and what we would hope is that they will provide the in-reach to the mother and baby unit in terms of health visiting.
Great. So outreach team would be something that I could potentially apply.
Yeah.
Lovely. Thanks very much. Thank you.
Hi, sorry, it's Lauren. I've got myself off mute now.
Oh, hiya, Lauren. Nice to have you back.
Hi. I was trying to do it the whole time, but it wouldn't do it. I was just wondering, I'm a qualified nurse associate, which obviously means I'm band 4. So would that mean if I was going to go for a role, it would be the nursery nurse?
You would have to have the nursery nurse qualification, so an NEB or the MVQ level 3.
So so being a band 4 with a pin wouldn't qualify for that role?
No, because it is it's a very niche and unique role in terms of the childhood bonding and attachment and child development. So it's very much a nursery nurse qualification.
Okay. So would there be any roles available, or?
So the only there's not a nurse associate role for the mother and baby unit. The staffing model is nurses and then clinical support workers.
Okay. The other thing I was going to ask, but I don't know how that'd work if there was no role to start off with, but if there was like opportunities to, because I want to top up to mental health, and they don't do that in the trust that I work at because we don't have a mental health unit. So we have CWP staff members, and they said you'd have to come over to us to, but there are apprenticeships available to do the top up. Do you facilitate anything like that, or?
The mother and baby unit won't be at the moment. Whether it will do in the future, I don't know. But certainly when it starts off, it won't be able to facilitate that. But you could get in touch with CWP Education, who could tell you about any other apprenticeship opportunities, because I know that there are those opportunities across the trust at times.
Okay. All right then. Thank you.
Thank you.
Thank you. So we're coming to Amy next.
Yeah, thank you. I had 2 questions, sorry, if that's okay.
Yeah, of course.
My first question is related to the MBU and the use of the Mental Health Act in the MBU, and if there's any kind of exclusion criteria. And I guess what I'm getting to is violence and aggression, drug use, things that you might see on like a general acute ward. Are there certain kind of
there's additional risk assessments. I can see Bev's put a hand up, and I think you probably want to come in and answer that, Bev.
Yeah. The Mental Health Act and the criteria for the unit, they're the kind of 2 separate things. Mental Health Act wise, we will admit Section 2, Section 3, all the same things you would in a general ward. If it was someone on a CT, I mean, it's very rare that would happen, but someone on a CTO recall, all of that would just be exactly the same. We wouldn't have women who are specifically violent or aggressive on the ward, I guess for obvious reasons, as part of our risk assessment, because we have babies, and the design of the ward means that we're not going to be like a PICU, so we won't have a seclusion room, or there'll be no provision of that sort. So we have had it within the community service where women have needed to be admitted, but they've been so disturbed or so unwell, we've had to admit them to acute wards rather than it doesn't happen very often, but it does happen. So yeah, anyone who would, let's say, meet the criteria for a PICU or needing, that level of, or needing restraint or anything like that from the get-go, they wouldn't be coming to our unit. Now, should they be coming well while they're on the unit, we would need to consider a transfer over to one of the wards, either at Bowmere or elsewhere. But but Mental Health Act, exactly the same application of it. The criteria for what we can actually manage on the unit will be different.
Thank you so much. And I actually have 3 questions, I'm sorry. I'll be really quick. One is about child protection. Would that come under the roles of the MBU? Because you've mentioned kind of social work would be involved. Would that be assessing kind of risk to the baby?
So we've got a specialist social worker that her role bridges the community perinatal team and the mother and baby unit. So being subject to child protection would not exclude anyone from coming to the mother and baby unit.
Yeah.
Likewise, just because someone is admitted to a mother and baby unit doesn't necessarily mean social services need to be informed. It's exactly the same process as either in the community or in other areas. If there is any risk identified and that needs referring into social services, it'll be done very collaboratively and holistically. And if someone is admitted and their child's already open to social services, then we will continue working with those with the social workers involved.
Well, I guess the reason I'm asking is I've worked in MBUs before in Australia, and one of the really big roles of the mental health nurse was actually kind of assessing parental capacity, and it didn't really feel like it was in our scope of practice because there wasn't any additional training on it. So thank you, that's good to know. And my last question is actually more of a request, if I'm able to speak to I'm not sure if it's Deborah, if I could speak to her maybe separate to this meeting, because I'm hoping to relocate to North Wales, so it would be lovely if I'm able to touch base at some point just about the outreach role there and the perinatal community team.
That's great. Yeah, if you pop your contact email in the chat, and then I will get back to you.
Thank you so much.
Thank you.
We'll be able to pass that on, so no problem. So we're going to come to Sophie next. You should be able to unmute yourself.
Hi, yeah, it's just a quick question really. Would you recruit any paediatric nurses?
No, it's mental health nurses, because it's the mum who is our patient.
Yeah, that's fine. That's great. Thank you.
Thank you.
Thank you. So we've still got quite a few questions in the chat, so we'll come over to them now. So will we be using system 1 whilst on the wards?
Yes.
So kind of the for those who don't know what system 1, it's kind of the clinical system, isn't it, Sarah?
Yeah, it's electronic patient records, and it's the same as the other wards across CWP. It's system 1.
And can you apply for different roles and interview once, say for outreach or MBU? Will there be that kind of cross recruitment?
We'd have to have a look at that, but probably not, because the questions and the approaches will be different for each group of staff.
Amanda, I saw your hand pop up there. I didn't know if you wanted to elaborate on that one.
Yeah, I was just going to say the same. It would just need to be on a sort of role by role basis, really, wouldn't it, Sarah, to make sure the right questions and criteria are being met for each role.
Yeah.
Thank you. And will we be recruiting housekeepers at Seren Lodge?
Yes, there is a domestic role that will be put out separately by our domestic team.
Thank you. Answer that one. Just I think I'll just double check and scroll through, but I think we may be with 5 minutes to go. We've got a couple of hands pop up, so we'll be able to take a couple more questions, but I think we've answered the majority of the ones in the chat. So Kirsty, you should be able to take yourself off mute. Oh, try again. There you go.
Hi, sorry, Mike's just playing up. What's the website that the jobs will be advertised on, please?
So through NHS Jobs, so all the usual, however any NHS job it puts out for our recruitment, they go through NHS Jobs, they go on all of the main sort of recruitment sites for NHS, they'll all be on there, on the CWP website as well, on the internet. There'll be links for it.
Right, okay, perfect.
And then obviously for the North Wales job, for the outreach team, Debbie, I'm assuming there's a page there. Yeah. But NHS jobs will have them all on.
Perfect, thank you.
Yeah, if you keep an eye on the CWP website as well, we'll make sure, because most of the jobs are going out at the same time, we'll make sure that, and they're going out for a little bit longer than usual, that we'll make sure that it's really easy to find on the website. I had a hand up from Amy.
Yeah, I'm sorry, I can't access the chat. So
Okay, don't worry.
yeah, I don't know how to give you my email because I can't access it. I don't have access.
Don't worry, Amy, I think from your registration, if you're happy, I'll be able to pass your details on to Debbie.
Thank you so much.
No problem.
Thank you.
I'll just come across to the chat and check we haven't had any more questions. Is there likely to be an outreach nursery nurse role for North Wales?
I don't think for either. For CWP or North Wales, there's not an outreach nursery nurse role.
And I think, oh, Elaine, did you want to come in there? Oh, you're on mute, Elaine.
I've put mine, Sarah's and Debbie's email addresses in the Q&A section, so if anybody wants to contact us through our email, they can.
Perfect, that's really helpful, thank you. So with a couple of minutes left, I think we've answered the majority of the questions. I don't think we've got anyone with new hands up. So thank you everyone for joining our session today. The level of interest and questions has been really, really good. We'll put a recording of the session on the website towards the end of the week. Just if you could pass it on to any colleagues or contacts who weren't able to join us today who are interested. But we look forward to hearing from you again, and an exciting year for us. So thank you.